The Health Department calling for vigilance following 2 lab-confirmed cases of cholera. Health Minister Dr. Joe Phaahla saying the cases were detected in sisters who had travelled from Johannesburg to Malawi. Cholera mainly spreads through contaminated and polluted water, and Malawi is currently battling an outbreak. The Minister joins us now via our video link for more on these developments and what you and I should know about. Minister Phaahla, it's great to have you on the program. Thanks very much indeed for making time to speak to us. So these cases, as I mentioned, were traced to people with a travel history, but I wonder what they say about the possible spread of cholera in the country.
Well, it is possible that it can spread in the country, and that's why we're having this call for vigilance and surveillance from our side. Basically, as you've said, these are 2 sisters who traveled for a funeral in Malawi and came back. And on their way back from they started having some abdominal symptoms in the bus. And when they came back, one of them developed full symptoms of cholera in the form of diarrhea, vomiting, abdominal cramps, fever. And when she was tested, she was found to be positive for cholera. And when the team did the tracing, the sister also was confirmed to be having cholera. Both patients stable and admitted to hospital and discharged. But there's a third one, contact, who was also exhibiting the symptoms, also admitted to hospital. And as of yesterday, the lab was still, processing, the specimen for to test for cholera. Now, the risk, of course, as you have said, because cholera is a bacteria which spreads through, when the person who's been infected gets in touch or contacts water or food, and somebody else, consumes that water or food, then the next person can also have, can be infected with the bacteria. But usually it's when the whole system of water is not, clean, and that's where you find problems like as Malawi and also Mozambique is experiencing.
Yeah, and we'll speak about how much of a threat that poses to us here in South Africa, given some of our infrastructure issues around water distribution. But my understanding is that these sisters were traveling in a bus when they were moving from Malawi to Johannesburg. What do we know, if anything, around the contact tracing of people who were in that vehicle, given the possibility that this may have spread to them as well?
It's possible. So our teams from the National Health, Port Health, and also from Gauteng are following up on that. But I must say that because it is essentially not, people who are just in the bus would be at minimum risk. It will be those who may have shared some utensils during the trip, those who may have shared consumables. So it would usually be people who are, either friends or family in that trip who would have maybe, as I'm saying, it's a bit of a long trip on the bus, a couple of hours. So in the process, they may have been having some provision of food, water, but it would really be people who are very close who would have shared such items. But otherwise, everybody else who's simply in the bus, unless if maybe through, I'm not sure whether the bus itself may have ablution facilities, in which case if there might have been some contamination there and others touch on those ablutions, that might be the risk. So there is a follow-up checking on those, but because in terms of the time, it takes, if somebody gets in touch, in contact with such a bacteria, it will take at the most about 2 to 5 days. So mostly those who would have been on the trip by now would have presented themselves to a health facility if they had any symptoms. But our team, is continue to trace.
Sure.
In terms of locally, of course, if the two people stay in an area which is quite risky, deep slot, in terms of the water facilities. So our health team is also doing further contact tracing in the residential area of Deep Slot because, as you know, this is an informal settlement. So the possibility of contamination of water especially, which is what most people share, that may be the risk in that area.
Yeah. The last time South Africa was dealing with a major outbreak was back in 2008, 2009. That's when there were thousands of cases. And even then, it actually began with imported cases at the time from Zimbabwe through Limpopo. I wonder whether you reckon we have any fighting chance against preventing a repeat of that happening when we aren't really able to bring the situation under control beyond our borders.
At the current moment, I wouldn't say we're really at a high risk. The problem in 2008, 2009 was that the major outbreak was just across our border in Zimbabwe. And the areas which were largely affected were Limpopo, just across the Beit Bridge in the Musina area. That's where we had huge numbers. And that was because there were a lot of travelers by foot. As you know, people just cross and also through, again, buses, kumbis. And, on a daily basis, there are huge numbers of people crossing across the Beit Bridge, even coming for health services in the Musina area. Of course, it didn't only end up there because others proceed to other parts of the country, including Gauteng. But at this time, because we don't share an immediate border with Malawi, although there is a risk on the eastern side where we share the border with Mozambique. The numbers at this stage with Mozambique are not as high as in Malawi, where we're currently talking about close to 38,000 who have already been affected by this disease. In Mozambique, it's just around 3,000. It's still a risk. So on the eastern border, we do need much more vigilance. But from the Malawi side, at this stage, the traveling is not big numbers as we had in 2008, 2009 across the Beit Bridge. But nevertheless, it still calls for vigilance. It means that our port health authorities still have to be very vigilant in terms of we do at the border post. There is whether there is an outbreak or not, there is a health questionnaire, and if people exhibit any signs and symptoms, then they have to be subjected to a clinical check. But at this stage, we're not really, extremely alarmed in terms of this. So we think it's something which can still be manageable, but we will be monitoring the situation.
And we'll be monitoring the story with you. Health Minister Dr. Joe Phaahla, thanks very much indeed for speaking to us. Really